7 critical early signs of prostate cancer you need to know now. Imagine being able to recognize the early signs of prostate cancer before it progresses, giving you a head start on treatment and a fighting chance at a longer, healthier life. The next few minutes, we're going to uncover 7 critical early signs of prostate cancer that you need to know now. Whether you're directly affected or simply care about your loved ones, this information is vital. As we walk through these warning signs, remember, knowledge is power. Early detection could mean the difference between effective treatment and a much tougher battle down the road. Before we begin, if you find value in health tips and empowering insights, hit that like button and subscribe for more life-changing content. This isn't just about clicking, it's about joining a community that prioritizes prevention, awareness, and well-being. We're here to provide trusted information so you can take proactive steps toward a healthier future. Now let's break down these signs, starting from number 7 and working our way to the most critical warning sign at number 1. Each sign will be explained in detail, along with what to do if you notice any of these symptoms. So grab a notepad, stay tuned, and let's dive into these essential early indicators that could make all the difference in your health journey. Sign number 7, frequent urinary tract infections or difficulty urinating. One of the early red flags you should never ignore is recurring urinary tract infections, UTIs, or persistent trouble urinating. You might notice infections popping up more often than usual, accompanied by a burning sensation, cloudy urine, or lower abdominal discomfort. But here's what's even more telling: a constant feeling of needing to go, yet struggling when you try. You might strain only to produce a weak or inconsistent stream. While it's easy to dismiss these as minor annoyances, their recurring nature could be your body's way of sounding the alarm. Why does this matter? Because your prostate surrounds the urethra, and when something's off, urination is often the first place it shows. If these symptoms keep coming back, don't wait. Talk to a doctor now, because catching it early could change everything. Sign number 6, weak or interrupted urine flow. At number 6 on our list is a symptom many men dismiss as just another inconvenient part of aging: weak or interrupted urine flow. If you've noticed that your stream isn't as strong as it once was, or if it starts and stops unpredictably, it's easy to brush it off with a resigned, "Well, I'm getting older." But here's the reality: this isn't normal, and it could be your body signaling a deeper issue, particularly with your prostate. A healthy urinary flow should be smooth, steady, and relatively strong. If you find yourself straining to start urinating, or if your stream has weakened to a frustrating dribble, your prostate may be to blame. The prostate gland surrounds the urethra, and when it becomes enlarged, as in benign prostatic hyperplasia or BPH, or inflamed due to infection or other conditions, it can compress the urethra like a kink in a garden hose. This obstruction disrupts urine flow, turning what should be a simple, effortless act into a prolonged and sometimes painful struggle. Why should you take this seriously? Because ignoring it can lead to worsening symptoms such as urinary retention, inability to empty the bladder fully, increased risk of urinary tract infections, UTIs, or even long-term bladder damage. Tracking your symptoms is crucial. Note how long it takes you to empty your bladder, whether you feel like you're straining and if the flow is consistently weak. These details help your doctor determine whether the issue is BPH, prostatitis, or something more serious like prostate cancer. Sign 5, the midnight alarm you shouldn't ignore. Waking up multiple times each night with an urgent need to pee isn't just annoying, it's your body sounding an alarm. That relentless cycle of disrupted sleep and bathroom trips often points straight to prostate trouble. An enlarged prostate doesn't just block urine flow, it tricks your bladder into panicking over small amounts of urine, especially at night when circulation changes amplify the problem. What starts as minor inconvenience can snowball into serious health risks, from chronic exhaustion to increased fall hazards in dark bedrooms. The real danger lies in what else might be lurking behind these nighttime urges. Blood in the urine, burning sensations, or accidental leaks aren't just growing older. They're red flags waving at you to get checked. Your sleep isn't the only thing at stake. Untreated prostate issues can spiral into bladder damage, infections, or even permanent urinary dysfunction. That midnight sprint to the toilet could be the warning sign that saves you from bigger problems down the road. Here's the good news. This isn't a life sentence. Simple steps like tracking your symptoms can give doctors the clues they need to help. Today's treatments, from lifestyle tweaks to targeted therapies, can restore both your sleep and your prostate health. The first step: stop dismissing those nighttime wake-up calls as normal aging. Your body's talking. Are you ready to listen and take action? Sign number 4, blood in urine or semen. This is one of the most alarming symptoms, and for good reason. If you notice pink, red, or brownish urine, or see blood in your semen, your body is sending you a clear warning signal. While there are other possible causes like infections or kidney stones, when this symptom appears alongside other prostate-related issues, it's time to take action immediately. Blood doesn't just show up without reason. It means something inside isn't right. Whether it's inflammation, an infection, or something more serious, this is not something you should ignore. Even if it happens just once, make an appointment with your doctor right away. Early detection could save your life. Now, let's talk about sign 3, persistent pain in the lower back, hips, or pelvis. This isn't your typical soreness from a long day or a pulled muscle. This is a deep, lingering discomfort that doesn't go away. You might feel it as a constant ache in your lower back, sharp pains in your hips, or an unexplained heaviness in your pelvic area. Many men dismiss this as just part of getting older, but here's the truth. Your prostate is located right in this region, and when something's wrong, the pain can radiate to these areas. If you've been dealing with this kind of pain for weeks, especially if it's getting worse, don't brush it off. Write down when it happens, how long it lasts, and what makes it better or worse. Then take that information straight to your doctor. Next up is sign 2, erectile dysfunction that comes out of nowhere. Every man experiences occasional issues in the bedroom, but if you've noticed a sudden or worsening problem with getting or maintaining an erection, especially if it's paired with other symptoms like trouble urinating, it could be a sign of prostate trouble. Your prostate plays a key role in sexual function, so when something's off, ED can be one of the first warning signs. This isn't something to just accept or try to fix with pills. It's your body telling you to get checked out. The sooner you do, the sooner you can get answers and take control of your health. Finally, we come to sign number 1, unexplained pelvic pain. This is the most critical warning sign of all. We're talking about a deep, persistent pain in your pelvic area that doesn't go away with rest or over-the-counter pain relievers. It might feel like a constant pressure or a sharp, stabbing sensation that radiates to your thighs or lower back. This kind of pain is your body's way of screaming for attention. Your prostate is deep inside your pelvis, and if something's wrong, this is often where you'll feel it first. Ignoring it could mean missing a crucial opportunity for early treatment. If you've been dealing with this kind of pain, don't wait another day. Make an appointment with your doctor immediately. Prostate cancer is one of the most treatable forms of cancer when caught early, but waiting too long can turn a manageable situation into a life-threatening one. If you've noticed any of these symptoms, don't make excuses. Take action. Write down your symptoms, schedule a doctor's visit, and get the answers you need. And please share this video with the men in your life. You never know. This information could save someone's life. If you found this video helpful, hit that like button, subscribe for more life-saving health tips, and drop a comment below. Have you or someone you know experienced these symptoms? Let's start a conversation and keep each other healthy. Thanks for watching, and remember, your health is your greatest asset. Take care of it.